Morning team, how we doing? So first lesson, year 12. You've just done your Ergogenic Aids exam question and the plan to fill out. So we've now got to move on to training programs and principles of training. Now, just to kind of let you know where the work is, SharePoint, A-level, AMP folder, and then we're going to be using these two ones here. So we've got the periodization PowerPoint I'm going to go through now, and we've got your principles of training booklet that you can be filling in as you're listening to me or going through the PowerPoint yourself. Remember, you've also got the Everlearner, where there's a section on periodization as well that you can go through. Okay, and you know, as I've said through the whole time, I'm on email, I'm on Teams, ask questions at any point. The last thing I want you to do is struggle and get behind. So do let me know if you need any help at any point. Right, so just to click on the PowerPoint, I will nip in and out of shot. Bear with me. Okay, so what we're looking at is designing a training program so that you as an athlete can achieve your personal bests. Okay, now at GCSE we did the principles of training, we did the methods of training. We will go into methods of training again, but later on, kind of a few PowerPoints time. All this is about designing a training program that suits you as an individual. So it's to meet your specific demands of the individual. What training is the basic building blocks of a training program. So it's putting lots of little things together to enable you to create this big training program. Now at A-level we use Mrs. Vop as our principles of training. So last time we kind of used specificity, progressive overload, reversibility. These are similar, but there's some slight changes. So M is moderation, which is new to you. Reversibility you know, specificity you know, variance is new to you, and then you've got overload and progression are two separate factors, not progressive overload anymore. They become two separate aspects. So we will go through those so that you know exactly what they are. You know that the principles of training are the rules. They're the rules that you should abide by whilst creating a training program. If you stick to these rules, then you'll be able to plan and be able to get the most effective training program, which will give you the results that you need. Right, moderation. So moderation links into intensity and duration. It's making sure that it is correct for you. Okay, so depending on whether you're a beginner, depending on whether you're an advanced performer, you've got to get the moderation, the duration correct of your training. Now that's for two reasons. One is to prevent you becoming injured, which means obviously that links into our reversibility. But the other one is if you're doing incorrect intensity and duration, it means that you're not going to get the improvements that you would require. Reversibility, you know, is 3 months lost in 3 weeks. You've been told that before, and it's aerobic capacity that will kind of vanish far quicker than anything else. So that's your function of your heart and lungs. That will disappear. Strength you kind of maintain for a little bit if you don't do any training. Eventually it will go and you will get atrophy, but it's your aerobic capacity that vanishes within 3 weeks. Specificity. Now at GCSE we had specificity and individual needs. At A-level we don't, we merge them together. So specificity is inclusive of individual needs, the sport, the energy system you require, muscle fibre type that you've been working, and the movement patterns. So are you sidestepping? Are you dodging? Are you sprinting in straight lines? Are you running angles? All those movement patterns need to be specific within your training, so you need to make sure that they match so that you get the best improvements that you require. Variance is kind of what it says. It's just you varying the exercises that you do. Okay, the last thing you want to do is just do the same exercise over and over again, because that creates boredom, and if you become bored then you lose your motivation, which means you then don't exercise, which means you don't get the improvements. Overload is the inclusion of or the use of FIT, frequency, intensity, time and type. Frequency, obviously the amount of times that you do it. Intensity is how hard you're working. Time is how long you do it for. Type of activity links into variance, so it's changing it. And then you've got your progression, which is the gradual increase over and over again, each week, each kind of 2 weeks, monthly, to allow you to create the hypertrophy or the increase in aerobic capacity or the required benefits that you need for your sport. Other things that when we're creating a training program that you must always consider are testing. Okay, for every single training program you have to use testing. If you don't test, then you've got no data to go off. If you've got no data to go off, then how do you know you're actually improving? So you should always have some sort of nationally recognised test at the start and then towards the end. So an example is the multi-stage fitness test. Will give you specific data at the start and then at the end, so you can compare whether you've improved. The other things that you should consider and always have as part of a training program is your warm-up and cool-down. You know the reasons why for warm-up and cool-down. I don't need to go into those, but you should have those fully embedded within your training program. So, what I want us to discuss is how can these principles of training look for long-distance runners or a strength-based athlete. So what I want you to think of now and kind of jot down. So what you could do is you could pause the video now and just go back to Mrs. Vop and just write kind of little sentences with regards to how Mrs. Vop could be used for a long distance runner and for strength-based training. So you could pause, have a go, and then restart it, and we'll go through it now. So, a long distance runner, we go back to Mrs. Vop. Long distance runner for moderation. So the intensity is going to have to be sort of around that like 75-80% mark. So we're still working the aerobic capacity. We're not into the anaerobic, because if they're a long distance runner, they're not using that anaerobic phase, just the aerobic phase. And the duration is going to have to be a long duration, because the event that they're actually completing is likely to be a long duration. So then our training needs to be long duration. There's no point doing 10-15 minute spells of exercise, because that won't link to what we're doing. Reversibility for our long distance runner. Okay, so we are working aerobic capacity all the time. So we don't want reversibility to take place. So we need the training to happen on a regular basis, because if we take that training away, we're going to lose all of the aerobic alterations and adaptations. We're going to lose really quickly. Specificity. So how are we going to make it specific to us? Well, first of all, we need to know about the individual. A male, female. Are they old, young? Are they injured or fully fit? Have they got any medical needs? Okay, so we need to take all of that into consideration to make sure that the training is specific to our athlete. The sport they're doing. So a long distance athlete. Now, are they a runner? Are they a cyclist? Are they a swimmer? Are they a rower? So we'll go with that they're a runner. Okay, so the majority of our training has got to be running based. If it's not running based, then it's not going to work the movement patterns that are going to be required for the race. Now, we will do variants and we will alter our running. We might do some swimming, we might do some cycling, because it takes the weight off. But what we need to make sure we do is that we create that movement pattern that we're going to perform in the race. Energy system, we've already said up here that we're going to be working at sort of 75-80%. So we're working the correct energy system for our race, which then allows us to move to create to use the correct muscle fibre type. Now, obviously, we're going to be using the slow oxidative or the type 2A maybe. So we're going to be working these muscle fibres, which means we're going to be strengthening them. It means we're going to be increasing the mitochondria. It means we're going to be increasing the myoglobin stores in there. We're going to have capillarization in those muscle fibres as well. It's all working those muscle fibres and movement patterns we've mentioned. Variants, I said we might do some cycling. We might do some cycling because that will prevent injury, because it's a non-weight bearing exercise. It will also take away the fact that we're running constantly, which will then prevent the boredom basis kicking in, which means we don't lose motivation. We would increase this, we would apply this. Now, depending on the level of our fitness, Frequency, we might build from 3 times a week to 4 times a week. We're not going to go to 7 times a week because that will lead to an injury, which will lead to reversibility. Intensity, we might slowly start to increase the heart rate. Okay, so if we're working at 75%, a few weeks later we might work at 76%, then 77%, just to try and stretch that threshold as high as possible. Remember, if we can move our aerobic threshold into sort of 81, 82, 83, 84%, then we can work at a far higher intensity for longer, which means we complete the race quicker. Time, that's the most frequently kind of the overload principle used with regards to endurance-based athletes, is stretching out the time that you're performing for. If you're training for a marathon, you're going to start off by running for half an hour. 6 months down the line, you'll be running for 3 hours. Okay, so you overload it gradually over time. And then the type of exercise linked into our variance. Progression is that gradual increase. Okay, so I said we're going to move from half an hour to 3 hours, but we're going to do it over a 6-month basis. Reason for that is to prevent this injury from happening up here. Okay, so we might do half an hour week 1, and we might do 35 minutes week 2. We're not doing a huge increase, sort of a 10% increase each week, to just try and gradually increase so that our body makes the adaptations over time.